John Dempsey's on.
Team F5 to help for requesting a stroke alert. We have a 54-year-old female.
Acute stroke care is extremely time sensitive. The stroke team works closely with the emergency department to ensure that we're delivering effective and expedited care to our patients.
When someone is having a stroke and they come in by EMS, we'll get a pre-alert notification, and then the charge nurse will activate our emergency alert system. So that way when the team arrives, they are met by a primary stroke response team. They get a quick assessment and go right to CAT scan.
So that we can treat you appropriately if it's a bleeding stroke or if it's a blood clot type of stroke. We're able to tell on the CAT scan. In that first 3 to 4.5 hours, we're able to give medications to try to stop a stroke. If there is a clot, we will activate that team, and then they're able to access the clot and pull it out. And that way we can save more brain tissue and help patients get better quicker.
Following that, we determine if they would be going to one of our stroke units or the neuro ICU unit for closer monitoring.
We have a lot of technologies in the ICU that we can help us monitor the patients. One of the things is a transcranial Doppler, and that's an ultrasound that we can place right at the head to look at the blood vessels in the brain.
When patients go to our ICU, they have a critical care trained nurse who's with them one-on-one for the duration of their stay. Our nurses are specially trained in stroke. They have their NIHSS certification, which takes them through a full stroke assessment, and they will have to assess their stroke patients at certain intervals depending on what the providers order, so that way they can know if any changes happen and keep the providers updated to see if they are then candidates for any kind of intervention that might happen.
My assistance is helping transition patients after leaving the hospital. Some people get to go home, some people have to go to an acute rehab or even a longer term facility. So I help with the transition from the inpatient to the outpatient setting, making sure that they have all that they need when they leave, as well as educate them and support their families before leaving the hospital to make sure that they're not alone on this journey.
At UConn Health, quality and safety is at the heart of what we do, and that obviously extends to our stroke program as well. We're extremely proud of the care we deliver, which is made possible by collaboration between all the teams that are involved.